And guys, this is now the third live, which means you have to talk and interact with me more, okay? Actually, quite simple to remember, and I will tell you also, give you a few points, tips and pointers on how to remember it, okay? By the way, these are illustrated by dentists within our company. One, correct, fantastic. Okay, so if you now imagine this, nasopharynx is on top, then you have the oral pharynx below it, then you have in front of it, you have the oral cavity, correct? Now, if you think about the arrangement of the tonsils, you have 2 ears, so 2 auditory tubes, so there should be 2 openings in the nasopharynx, which is why there should be 2 tubal elevations. Right behind those tubal elevations is an aggregation of lymphoid tissue called tubal tonsils. Okay? I'm revising what we've done in the last class. It's a very simple topic. It's an easy way to get those. It's usually a short note question, I think. Easy way to get those quick 5 marks.
Do you enjoy learning without distractions? Download our app now.
Okay, so welcome One Stop Anatomy. This is our third live. And guys, this is now the third live, which means you have to talk and interact with me more, okay? First time understood, everyone shy. Second time I can still forgive, but today it'll be nice if everybody can chat. Okay, so today's topic is palatine tonsils. Okay, first we will talk about what we're going to do today. Previous year's questions. You are all students, most of you are students, so I do understand that question papers is definitely, exam is the priority, right? So we will look at previous year's questions first and then discuss that. So this is usually how it comes. First is the external features of the tonsils. Tonsillar bed, which is a very, very popular Viva question, NEET exam question, NEET PG question, anatomy PG question in case there are anatomy PGs here. I understand last time there were a few anatomy postgraduates here as well. Then, of course, nerve supply, blood supply. These are actually quite simple to remember, and I will tell you also, give you a few points, tips and pointers on how to remember it, okay? And some clinical anatomy. Okay, so now whatever I'm going to cover today is all covered in our mind maps. I don't know if you've seen these mind maps. They are a fantastic revision tool because if you know how to read a mind map, we go clockwise from the 1 o'clock position, 4 o'clock, 6 o'clock, 8 o'clock, 10 o'clock. Usually there are that many branches, and then you cover up the whole topic. And if you see, the mind maps also do have very detailed images. By the way, these are illustrated by dentists within our company with great detailing. We'll discuss the same images so that when you revise using the mind map, it's all familiar and it comes back to you. Okay. Okay. If you've been to my previous sessions, you know I always start with the WH questions. So first thing, as soon as you see a topic question in your paper, you ask yourself what it is. In this case, palatine tonsils. We know that all the tonsils are actually aggregations of lymphoid tissue, right? Lymphoid tissue, when you think of it, first thing that you think of is defense mechanism of your body because they have lymphocytes, macrophages, which depending on where it is in your body, especially the tonsils, they are all positioned in the oral nasopharynx, the oral cavity, in the oropharynx, right? Which means whatever you breathe, eat, drink, any sort of foreign body or a pathogen that comes in through these routes is trapped and dealt with. Okay, so it's the first line of defense. Right. Now, okay. Now, can anybody tell me what are the other tonsils in that area that you know? You can put it in the chat box. If you've been to my previous sessions, you would be able to answer this, I hope, or if you're following our MCQs, etc. Yes, lingual tonsil. You can tell me, name a tonsil and tell me where it is. If you say lingual tonsil, where is it? Yes, nasopharyngeal tonsil or pharyngeal tonsil, where it is? Yes. Tubal tonsil, pharyngeal tonsil. These two are in the nasopharynx, correct, in the nasopharynx. And then you have the lingual tonsil, which is lingual, right? So tongue, related to the tongue in the oral cavity, okay? Then there's another one, of course, what we are dealing with today, palatine tonsil, also in the pharynx, but in the oropharynx, okay? Now, so we've dealt with the what is it? Now, these exclamatory marks here I've put because generally, if you look at this picture, it's a comparative picture. Okay, there's one tonsil that is pink, right? It's a healthy pink color. A healthy pink color indicates a tonsil that's not infected. Okay, but if the tonsil is whitish in color or has white patches on it, okay, or like whitish yellowish patches, this is an indicator of an unhealthy tonsil or an infected tonsil. Okay, and this is not hard to see, guys. If you have, like sometimes when you wake up with this horrible throat pain every time you swallow, if you actually go to the mirror, really open your mouth wide, stick your tongue out, and just say, ah, right? You may see white patches on your tonsils. Okay. And in most cases, you can do this saltwater gargle, betadine gargle, all that. But sometimes it reaches a point with so many white patches and severe infection in the area that it does warrant a dose of antibiotics. Okay. Okay. Just digressing here. Right. So this is the what. Now we'll talk about the where. Okay. Now we know that the tonsils are in the palatine tonsils are in the oropharynx. Okay. Right. Are the palatine tonsils, how many palatine tonsils are there? How many palatine tonsils do you think are there? Two, correct. So it's a paired structure. Okay. What about the lingual tonsil? How many lingual tonsils are there? Yes, it's actually an aggregation. How many pharyngeal tonsils are there? Tubal tonsils. One, correct, fantastic. Okay, so if you now imagine this, nasopharynx is on top, then you have the oral pharynx below it, then you have in front of it, you have the oral cavity, correct? Now, if you think about the arrangement of the tonsils, it kind of forms a circular structure, all the tonsils together, okay? A ring-like structure, which is why it is called the Waldeyer's ring. Okay, yes, Waldeyer's ring. Okay, I will explain this to you with a picture. So palatine tonsils, now you look here, right on top, you have the nasopharyngeal tonsil, or they also call it the adenoids, especially when it is slightly enlarged, quite common in little children. Then you have the palatine tonsils and the lingual tonsils. Okay. Now, if you look at this picture, the green here represents the green here represents this is where I'm telling you, okay, the title, it says what is it, but actually I'm talking about where is it. Okay, it is sitting in my previous class. I told you it is sitting in its own little cozy home, a triangular home called tonsillar fossa. Okay, so if it is triangular, it means it has to have three borders, right? Or you can say two borders, an apex and a base. Okay, now if you look at this image here, the purple represents, the light purple will represent the anterior border. Okay, the green represents the posterior border. So this is how the triangle is. Anteriorly, we have the palatoglossal arch. So which muscle will be inside that fold? It's actually a fold of mucous membrane. Okay, palatoglossal arch it forms. Yes, the muscle is called palatoglossal, which is one of the muscles of the palate, going from the soft palate to glossus means tongue. Behind that, descending like the roof, behind like that, sloping down into the pharynx, we have another arch, which is called the green line here. It's called the palatopharyngeal arch. Okay? So that fold of mucous membrane has a muscle inside it. What do you think that muscle is called? Palatopharyngeus. Fantastic. Now, if you look at it, the dark purple actually forms the base of the triangle, correct? By just looking at the picture, can you tell me what is the base formed by? Just look at the picture. It's super easy to understand. Posterior third of the tongue. Is that what you're saying, Anna? Posterior. Yes, I think that's what she's saying. So it's called posterior 1/3 of the dorsum of the tongue. Yes, okay. This is the triangular fossa where the tonsil sits. But specifically, if an examiner asks you, which part of the pharynx does the palatine tonsil lie? It's one of the contents of the lateral wall of the oropharynx, okay? Now we go to the next WH question, why? When I say why, it means what are the functions? Why do you need tonsils? Okay. Now this will bring me back to this ring that I was talking about. Okay. Observe this picture. Right on top, you have the pharyngeal tonsil labeled. Next, you have the tubal tonsil. Then you have, if you see that pharyngeal tonsil, it's marked by a single structure. Then you have the tubal tonsil. It's a paired structure on either sides. Because tubal tonsil is where? Tubal, where the auditory tube opens into the nasopharynx, right? You have 2 ears, so 2 auditory tubes. So there should be 2 openings in the nasopharynx, which is why there should be 2 tubal elevations. Right behind those tubal elevations is an aggregation of lymphoid tissue called tubal tonsils. Okay, I'm revising what we've done in the last class. Moving down into the oropharynx, again a paired structure called the palatine tonsil. And then you have an aggregation, multiple little aggregations, but their entire structure together is called the lingual tonsil. That whole thing there forms a ring between nose, mouth, upper part of the pharynx. So just imagine anything going into your nose and your mouth is trapped even before it can go any further. Okay, that's the whole point of this defense ring right in the beginning. That's the why. Now we'll go to the anatomical features. In this, I'll be covering the gross features. So first of all, like I already told you, a healthy tonsil is pink, and an infected tonsil can either have whitish patches, yellowish patches, or even if you don't get to the point where it is so infected, inflamed. Infection means there could be pus, there could be white patches, there could be pus. Inflamed means it may not be that bad, but it is just really reddish and painful and sore, okay? Right. So what are the features? First of all, it has an upper pole and a lower pole because the tonsils are actually like little almonds, you know. Sorry. The tonsils are like little almonds, okay? So they have an upper pole and a lower pole. The upper pole is towards the soft palate, and the lower pole is actually towards the tongue. Simple to understand, right? What are the other features? Now, this is where it gets interesting. It has an inner surface. Inner surface means towards the midline. Anything that is towards the midline is called medial. Yes. Okay. So the medial surface faces the mouth area, which means if you think about it, whatever you put in your mouth, food or drinks, when you swallow, it actually probably will come in contact with, not probably, it has to, right? It will come in contact with the tonsils, correct? which is why it should be lined by an epithelium that can withstand wear and tear. Okay? Withstand wear and tear. Can you tell me what is that epithelium that withstands wear and tear? I've said this in my previous class. Let me give you a hint, okay? If the top layers keep getting rubbed off. No, guys, not pseudo-stratified. Pseudo means lies. Pseudo means it looks like it's stratified, but it's a lie. That is pseudo-stratified, okay? But we are now, no, it's not keratinized either. What is keratinized? Keratinized means the top layer is all dead skin, dead cells. Nucleus is gone, is dead. So now the cell becomes keratin. Yes, that's correct. It is just stratified squamous epithelium. Okay? Not pseudo-stratified. Pseudo is a single layer, which only looks like as if it is a multi-layer. So that's why you have to think pseudo means lies. Okay? You're not really multi-layer. You're just saying you're multi-layer. That's a pseudo-stratified. Keratinized is like what you have for the skin. Okay? But what we are talking about is a stratified layer, because every time the top layer gets removed, the bottom layer, which is just above the basement membrane, that's the basal layer, keeps producing more cells, which keep rising to the surface. Okay? Right. So if you remember, you write upper pole facing the soft palate, lower pole facing the tongue. One line you write in your paper, more than enough. Next, medial surface, lateral surface. Medial surface faces the midline, faces the oral cavity, therefore lined by the epithelium of the oral cavity, which is called stratified squamous epithelium. Done. Okay? But now there's also something interesting in the medial surface. Okay? It has tiny pits, small little pits. Okay? If you look at this, it's not a very smooth, here. You see this? This is called, check out the label, it's called a tonsillar pit. Here. Okay? Here. This. Now, when that pit, so this is a pit, it's just a little depression. But the mucosa, right, actually, one minute. The mucosa actually gets in. You see this? So any deep pit or a shallow pit that gets extended into the substance is called a crypt. Okay? It's basically nothing but a really deep pit. So this is a crypt. So the medial surface of the tonsil actually has pits which extend inward and are called crypts. Okay? Now these are lined by plenty of lymphoid tissue, rich in lymphoid tissue, okay? Macrophages. Right. So this is about the medial surface. So these are the points that you will write in your exam. Next, you'll talk about the lateral surface. Now, this is the lateral surface of the tonsil. So that means the lateral surface faces outwards, right? If you go outward from the mouth, what do you have? One important the uppermost circular muscle of the pharynx. What is that called? Chat box. Anybody? Superior constrictor. Fantastic. Okay. Now, inside the superior constrictor, or in the inner surface of the entire pharynx, is lined by a layer that lines the inside of the pharynx and then attaches to the base of the skull. It's all in the name, okay? Because it goes from the inside of the pharynx to the base of the skull, this inner layer is called pharyngobasilar fascia. Pharyngobasilar fascia, okay? This fascia lines the inner surface of the superior constrictor muscle. Okay. So that is this black line here. Here. Next, you have this muscle, which is the superior constrictor muscle. You remember last time I told you they are circular muscles, but it's not like they encircle the entire pharynx, right? It's all actually semicircular muscles. It's called the circular layer, but the shape of the muscle is actually semicircular. So if you see this here, this is a semicircular muscle, you see? And outside this muscle, another layer. This is called the buccopharyngeal fascia here. Okay? So PB or pharyngobasilar fascia. Then you have BP or BP or buccopharyngeal fascia. And in between that, you have one muscle called the superior constrictor. Okay? Now at UG level, these three structures is more than enough for you to remember. These three structures together form the bed of the tonsil, of the tonsillar fossa. So it's called tonsillar bed. Okay. So what is a bed? Basically, you will go and lie down on when you're resting, you will rest on something called, on the bed, right? So this is what it is. Okay. So the tonsil is basically lying on multiple layers, and these are called these multiple layers together is called the tonsillar bed. Okay. I hope this is clear. Now, this lateral surface, right? This is actually important because inside the medial surface, I told you, is lined by an epithelium. But actually, the lateral surface has a capsule. Okay. And this capsule is important because it's the capsule that actually attaches to the structure of its wall. Okay. So it's one of the structures that keeps the tonsils in place. Now, next. So this is the mnemonic PB, S, and BP for what? Tonsillar bed. Okay. Next we go. Oh, I had to tell you one more thing about the capsule. Is all the blood vessels, right, are coming from outside. Okay. So the capsule plays a very important role in that it sends septa inside, and along with that septa or through the septa. Yes. Through the septa, all the nerves, the lymphatic channels, and the blood vessels run. Okay. And that's how they reach the tonsils to supply it. So, did you understand a few points about the medial surface and then a few points about the lateral surface? Okay. If you note these down, then you're done. You'll get the marks you need. Next. Now, when I'm anyway telling you that the capsule allows certain vessels and nerves to get in, now we can see which vessels and which nerves are actually getting in. Okay. Here also we have a few mnemonics. There are two different mnemonics, one that I studied with, and then there's a new one that I found. I'll tell you both and you can use whatever you need. This is funny because I don't know whether this is the backstory, but my anatomy teacher actually would always mix up the P and the F, okay, most often. So I don't know whether this mnemonic came from there because, yes, that was a joke when I was a student, but I mean, could be. So he used to say, so this is the mnemonic that we used. It's called malpractice, like instead of malpractice. But there's also another mnemonic that I found online, love, father, and mother. So you could use whichever one you are comfortable with. This is what I studied, where M stands for maxillary artery, A stands for ascending pharyngeal artery, L stands for lingual artery, and F stands for facial artery. Branches small little tonsillar branches of these arteries is actually the blood supply of the tonsils. Okay. Now, can you tell me what is common between all four of these arteries? This is not related to the tonsil, but anybody in the chat box? What is common between these four arteries? Yes, they're all branches of the external carotid artery. All of them. Right? Okay. So predominantly we can remember that the tonsils are supplied by the external carotid artery. Right? Okay. So if you would like to use this mnemonic, love, father, and mother, love stands for lingual, father stands for facial, and stands for ascending pharyngeal, and M stands for maxillary artery. Branches of these arteries is the blood supply of tonsils. Venous drainage, lots of veins next to the tonsils. You know, right next to the tonsil, there is a space, okay, with connective tissue. What kind of connective tissue? Loose connective tissue, just loose areolar fibers. That is where all the veins of the tonsils are. So big para means next to, right? So you just remember that right next to the tonsils is a little space filled with connective tissue that is filled with these veins. So these are called paratonsillar veins. So the paratonsillar veins drain into the facial vein, and then that drains into the pharyngeal venous plexus, right? So venous blood from tonsils is carried through this channel. Next is the nerve supply. This looks complicated, but it isn't, and I'll tell you why. Glossopharyngeal nerves, cranial nerve number. Come on, guys, quick, fastest fingers first. 9, perfect. Okay. Glossopharyngeal nerve is the 9th cranial nerve. Excellent. Today, I'm seeing a lot more messages on chat today. Really nice. Okay. So the glossopharyngeal nerve sends out a branch called the tonsillar branch. Okay. Now, to remember this, you know that the tongue has a very interesting nerve supply, correct? So what is the nerve that supplies the anterior 2/3 of the tongue? I'm not going to change my slide because the answer is on the next slide. But anybody wants to tell me what is the nerve supply of the anterior chorda tympani? Yes, but is that for sensory? No, not 12. 12 is hypoglossal nerve, which is motor, okay? 12 supplies the muscles of the tongue. Means if you have to speak, to move your tongue, you need number 12, okay? So my teacher used to tell me every morning when you wake up, you think, today I will say 12 good words to somebody, 12 kind words to somebody, okay? That's how she taught us to remember that to say 12 kind words, you have to remember that it is controlled by the 12th cranial nerve. Nothing to do with the tonsil, but since somebody put an answer there, I'm telling you. Yes, that's correct. Lingual nerve. So lingual nerve is basically trigeminal nerve, right? What about the posterior 1/3? Sensory supply. That is right at the back, yes. But right at the back. Glossopharyngeal is the right answer. Okay? So now if you look at this, this is a great image to draw if this, and this is very commonly asked in your exam anyway. So first you draw the anterior 2/3 of the tongue, then you have the posterior 1/3 of the tongue, and then you have the part extending towards the root. Now somebody mentioned number 10, right? So yes, the vagus does have a role to play in this area, okay? But the posterior 1/3 of the tongue, we say the general sensation. And so number 9, right? It does not share its function at the back. It says, I will take care of sensation and I will take care of the taste. So glossopharyngeal nerve does both the general sensation and taste sensation. Now, what are these little structures here? What are these structures here? What are these two structures here? Yes, these are the palatine tonsils, which means anyway it is coming here, no, in this area of the CN9 jurisdiction, right? That's why it's understood that the nerve supply of the palatine tonsils, because of basically where it is the same as the posterior one-third of the tongue, right? Easy to remember, right? Okay. Yes. So that actually completes everything that comes for your exam paper. Okay. This is how the previous questions have come multiple times, that too. External features we discussed, tonsillar bed we discussed, nerve and blood supply we discussed. Now we'll go to the last part called the clinical anatomy. Okay, rapid fire round. What is inflammation of tonsils called? Come on, guys, fastest fingers first. Tonsillitis. Itis means inflammation. Okay. Yes, perfect. What is peritonsillar abscess? What is an abscess? An abscess is basically collection of pus. Okay. But the collection of pus, it's not like an external thing that will form and then pus. Yes, accumulation of pus. Okay. So if you think about it, if you look at this picture here, it looks like there's a transparent layer, right, on top. Correct? So that means the pus is actually under the mucosa. Okay. So it's a submucosal collection or accumulation of pus. Now, anything that accumulates under a particular structure will stretch that structure, right? And when it gets stretched, it causes a lot of pain. Okay. Which is why when pus is accumulated anywhere, this is a general rule for anywhere. Okay. When pus is accumulated in a place that does not allow it to, pus or a lump or a growth or anything, where there is a lot of pressure or tension, it does not allow, it pushes and stretches that area, it forces you to expand, which causes a lot of pain. Okay. Apart from this, because there is pus, it is a sign of a severe infection. There could be fever. Fever is a symptom, right? It's not really a disease. It's a symptom that there is an infection somewhere. Okay. So this is a peritonsillar abscess. And why it's called peritonsillar is because it's in the area around the tonsil. Okay. Next is tonsilloliths. What is the meaning of this? Tonsilloliths. Cyalolithiasis, we spoke about, right? Stones. Perfect. So I told you you have these crypts, pits that then lead to crypts. Yes? So sometimes these stones can form in these areas. Okay? Here they have represented it as little white marks, see? Okay? So stones in the tonsil could be in the crypts, is called tonsilloliths. Even if you write an answer, you write the name, you define it. You can even write like one or two symptoms if you remember. If you remember how to manage it, like I said, peritonsillar abscess could have fever. So to bring down infection, you might need antibiotics, right? Or actually what will happen? You have to manually drain this abscess also. Whatever I'm saying, when you remember, jot it down in your exam paper. What is the meaning of hypertrophy? Anybody? What is the meaning of hypertrophy? Enlargement. Okay. Anything that is abnormally large. Inflammation is itis, guys. Trophy means enlargement. Hypertrophy means enlargement. Hypotrophy means reduction in the size. Okay. So trophy basically refers to size. No. Number is actually plasia. Okay, even in muscle, we say hyperplasia of a muscle means it's increased in the number of muscle cells. But hypertrophy means there could be the same number of muscle cells, but each of those cells are enlarged in size. That's what it means. Okay. So tonsillar hypertrophy. I remember my PG teacher telling me, she said, "What is the size of the tonsil?" And then she told us to always remember that you can't actually quantify like the size of the tonsil, okay? Because a lot of factors affect the size of the tonsil, and not everything could be is indicative of abnormality. So, in general, you could say that it's like an almond size, but you can't really. Today, I finished the session in 45 minutes. But have I covered everything? Have you understood everything? Was it an informative session? A few mnemonics would help you, right? Excellent. It's a very simple topic. It's an easy way to get those. It's usually a short note question, I think. Easy way to get those quick 5 marks. If you had to draw, right, I would recommend that you draw this picture, okay, in your paper, because no matter what you are doing here, basically what you could do is, if at all you have to say tonsilloliths, just put some dots, white dots on it. And then if you want to say hypertrophy, you draw this outline and you make one bigger. If you want to put, if you want to say, you want to talk about the boundaries, or you want to talk about the tonsillar fossa is also a 2-mark question. Then you can talk about apex, soft palate, palatoglossal and palatopharyngeal arches, base of the tongue. So a triangular tonsillar fossa with the tonsil inside it. Okay? This is a good diagram to draw. The mnemonic for blood supply backed with a story makes it even more. Yeah. Yes. The mnemonics are a great way to remember, but more than mnemonics, right? I feel like if you have this, and this is out of experience, okay? In my first year also, I had a book, mnemonics. But what ends up happening is sometimes you would just memorize the mnemonics. And there have been times where I've gone for my exam and I remember the mnemonic, but I don't remember what the mnemonic stands for, you know? So while a mnemonic is a great way to recall, you also have to understand why the mnemonic is there, right? Like if I'm thinking about the glossopharyngeal nerve supplying the tonsil, but I'm also put logic into it, saying where is the tonsil? It is right there in the posterior 1/3 of the tongue, which means it shares the nerve supply. So more than mnemonic, I feel logic will help you. Okay. Okay. So that's it, guys. That's the quick revision on palatine tonsils. And like I said, mind maps are a great way to revise, because everything that is taught in this class are on that mind map. You just before the exam, look at the diagram, quickly go clockwise, and you're done, ready for the exam. Okay.
Wait, there's more. But before we go further down the rabbit hole, subscribe to our channel.